Good morning. We'll open the hearing, but we're beginning this hearing in rather unusual circumstances. The President of the United States is momentarily going on the air, evidently to announce an unsuccessful hostage rescue in which we lost some Americans who were being held hostage by a terrorist group, and evidently some European, Italian nationals as well. I'm not sure, but I just think the appropriate thing, if nobody minds, is for us to begin with a moment of silence and the lives lost and the families that are grieving right now. Thank you very much. I want to acknowledge before I get into my formal statement that as my ever able committee staff was reminding, Mr. Chairman, this hearing's for you. Okay, this really is obviously one of my favorite topics as not only a member of the Interior Probes Committee, but as a tribal member and somebody with deep interest in Native American history and the Native American circumstances. So I appreciate my fellow members of this committee also indulging me in this sense, but it's an important topic. And I want to also begin by recognizing, frankly, this is an area where there's been significant bipartisan cooperation in recent years in Congress, and I want to laud the President of the United States. He's actually, I think, done a terrific job in this area, everything from Native American the Native American summits, Native Nation summits that he hosts every year. Genuine effort. Certainly, both the Secretaries of the Interior and the Assistant Secretaries, including my good friend and fellow tribal member Kevin Washburn, that I've had the opportunity to work with, are really trying to make significant progress in an area that's been very long neglected. Now, nobody can fix a problem that's 500 years old in a matter of years. But so when we talk about things where we can do better, I want to acknowledge that this is not in any sense meant to be a criticism of the administration, because I think it's really trying to do better and is really trying to work across the aisle here. So it's just to try and educate us as a committee and more broadly the Congress, where can we do more? What should we do? Because I think there really is both parties, both chambers, but particularly between the administration and the Congress, an effort to try and begin to correct some wrongs that are very, very long-standing. So our aim is just to get better at what we do, and not to be critical of anybody, because I think again the administration has very, very much to be proud of, and I think, quite honestly, Republican Congress, and particularly Republican House, has a great deal to be proud of what they've been trying to do over the last few years. So, again, good morning. My pleasure to welcome our witnesses today to the Subcommittee on Labor, Health and Human Services, and Education to discuss Native American issues. Looking forward to all your testimonies. The federal government's relationship with federally recognized Indian tribes is guided by a trust responsibility to ensure the well-being of tribes and respect their status as sovereign nations. This trust responsibility is established in the Constitution, treaties, executive orders, and court decisions. The federal government is required to manage tribal lands and resources in a manner beneficial to tribes and Native people. This trust responsibility is not limited to those programs that are specifically targeted to American Indians and Alaska Natives. Many of the largest agencies that serve American Indians, such as the Indian Health Service and the Bureau of Indian Affairs, are outside this subcommittee's jurisdiction. However, there are many programs funded under our bill that impact American Indians and Alaska Natives, including those targeted to those populations, as well as broader programs that are used by tribes and tribal organizations. For example, the Department of Health and Human Services makes funding available through the Centers for Disease Control and Prevention to build capacity within public health systems to improve population health in tribal and non-tribal communities, while the National Institute of Health makes grant funding opportunities to study and improve the health of all Americans, including Native Americans. The Department of Education makes supplemental grants to local education agencies that serve a disproportionate number of Native students, and these school districts also receive IDEA funding to help provide services for students with disabilities, a group in which Native children are disproportionately represented. The Department of Labor has dedicated funding under the Workforce Innovation and Opportunity Act for workforce education and training programs that are designed to meet the diverse needs and traditional cultural values of Native Americans. Indian communities face extensive challenges related to health, unemployment, poverty, and education. Heart disease is the leading cause of death among American Indians and Alaska Natives. The CDC has funded an atlas of heart disease and stroke among American Indians and Alaska Natives to help health professionals tailor prevention programs to those communities. 1/3 of American Indian and Alaska Native children live in poverty. The high school graduation rate for Indian children is 67%, which is the lowest of any racial or ethnic group. Only 13% of Native Americans and Alaska Natives have completed a bachelor's degree or higher, compared to 29% of the population in general. Indian students are disproportionately suspended and expelled and are less likely to attend schools that offer challenging coursework that would help prepare them for higher education. Many programs in our appropriations bills are designed to address these issues, but there are obstacles that prevent these programs from meeting the nation's trust responsibility to Native Americans. Our goal for the hearing will be to define the challenges that exist for Native American tribes in working with the federal government and learn about how the government could better serve them and be a better partner. Today, I look forward to hearing from our witnesses about their perspectives on these issues. It's a particularly distinguished panel. I'd like to welcome Ms. Stacy Bolin, a member of the Sault Ste. Marie tribe of the Chippewa Indians. She serves as Executive Director of the National Indian Health Board. With support of a strong tribally elected board of directors, Ms. Boland's service at the NIHB has contributed to the organization's successful work to establish and elevate tribal presence for improving health care in Congress, promoted and strengthened the organization's service to all federally recognized tribes. James Parrish currently serves as the Executive Director of Education for the Choctaw Nation and has been the Senior Director of School of the Choctaw Language since 2009. He's an enrolled member of the Choctaw Nation and native of southeastern Oklahoma. Mr. Parrish is a third-generation educator who retired from public education in 2009 after a 34-year career in public education. He currently serves as chair of the Governor's Oklahoma Advisory Council on Indian Education. And Mr. Ron Allen is the tribal chairman and CEO of the Jamestown Squamish tribe. Mr. Allen is responsible for representing the tribe as the elected leader and for addressing political and policy issues and/or positions at national and state and local levels. As Chief Executive Officer, he's responsible for the executive administration of all the tribe's programs, and including education, career development, social services, housing, health, economic development, natural resource management, and cultural affairs. I look forward to hearing all your testimonies, and now I'd like to yield to my good friend and ranking member, the gentlelady from Connecticut, Ms. Delora.